Anand, and Doctors Tam and New as well. In the last few days, we have seen the downward trend of cases and the number of people in hospitals has also been going down. This is good news, and we thank Canadians for their continued efforts in fighting COVID-19. Nous savons que cela n'a pas été facile pour les
Minister
Canadiens.
LeBlanc, we know
Nous
that
vous
this hasn't been
remercions
easy for
pour tout ce que vous
Canadians,
faites
but we thank
pour
you for
lutter
everything that
contre
you're doing
la COVID.
to fight
But we are
COVID.
not back to a pre-pandemic normal, and the situation in Newfoundland and Labrador is a stark reminder that now is not the time to let down our guard. All governments are understandably concerned about the variants and committed to working together. I have spoken with Premier Fury, as has the Prime Minister, and we have committed to him that the federal government will provide any support necessary to help the people of Newfoundland and Labrador. We need to remain vigilant. And once again, we ask all of you to continue wearing a mask, to use the COVID-19 app, maintain a safe social distance, and check in on your family and friends virtually. I would now like to invite Dr. Tam and then Dr. New to say a few words.
Hello, everyone. Bonjour à toutes et à tous. There have been 820, including 21,311 deaths. Over the past week, there were on average over 98,000 tests completed daily across Canada, of which 3.1% were positive for COVID-19. Overall, disease activity and severe outcomes are continuing to decline nationally, and there are now less than 35,700 active cases across the country. Over the past week, on average, under 3,050 new cases and 75 deaths were reported daily. In our hospitals, just over 2,700 people with COVID-19 were being treated each day, including 622 in critical care. This steady progress demonstrates that a combination of community-based measures and individual practices works to slow the spread of COVID-19 as long as we can abide by and sustain these measures long enough. This is what the longer range forecast models have been telling us for weeks. And it's thanks to the combined that we have made crucial progress. But COVID-19 has come back with another twist. In the past 2 months, more contagious new variants have emerged in Canada and now appear in all 10 provinces. Starting with a few travel-related cases in the early weeks, these variants have been smoldering in the background and gaining fuel that now threatens to flare up into a new rapidly spreading blaze. There are now over 540 B117 variants, 33 B1351 variants, and 1 P1 variant. More worrisome is that at least 4 provinces are reporting evidence of community spread and outbreak activity associated with these faster spreading variants. The rapid rise of cases in a previously well-controlled situation in Newfoundland and Labrador is a testament to how quickly things can change when more contagious variants are introduced. Fortunately, the rapid, decisive public health response by the province is what is needed to stop a variant of concern in its tracks. This is a setback for sure, and no doubt we feel frustrated. But let's not allow that feeling to detract from the progress we've made since the holidays, which puts us in a much better state to deal with this latest hurdle. Because of our efforts, we are entering into a situation that many countries have faced before us in a much better shape. We have lowered infection rates across the country, protected our health system, prevented many severe illnesses and saved lives. Though we may feel tired and have all suffered losses, collectively, we cannot afford to take the brakes off. We need to protect our progress and keep the runway clear for vaccine programs to expand and begin to work. This virus has shown time and again that what works is a united front, quick action, and sustained effort. There is no time to lose on division. To get over this hurdle, we need to work together from a place of compassion, understanding, and a shared commitment to see things through. This weekend, a group of kids from Ottawa sent in the best Valentine's Day e-card ever. It was a beautiful heart-shaped collage with each kid holding a heart in their hands, thanking us for our work. I would like to pay it forward and share their thanks for the dedication and commitment shown by everyone in Canada. And I know we have what it takes to continue. So let's vanquish the variant and let's do this together. Thank you.
Bonjour à toutes et à tous.
Dr. New speaking. Good afternoon, all. There have been 826,924 cases of COVID-19, including 21,311 deaths. Over the past week, there were on average over 98,000 tests completed daily across Canada, of which 3.1% were positive for COVID-19. Overall, disease activity and severe outcomes are continuing to decline nationally, and there are now fewer than 35,700 active cases. Over the past week, on average, under 3,050 new cases and 75 deaths were reported daily. In our hospitals, just over 2,700 people with COVID-19 were being treated each day, including 622 in critical care. This steady progress demonstrates that a combination of community-based practices and individual practices works to slow the spread of COVID-19. This is what the long-range forecast models have been telling us for weeks, and it's thanks to the combined you and public health that we have made crucial progress. But now COVID-19 has come back with another twist. In the past 2 months, more contagious new variants have emerged in Canada and now appear in all 7 provinces. Starting with a few travel-related cases in the early weeks, these variants have been smoldering in the background and gaining fuel and now threaten to flare up. There are over 540 B.1.1.7 variants, 33 B.1.351 variants, and 1 P.1 variant. More worrisome is that at least 4 provinces are reporting evidence of community spread and outbreak activity associated with these faster-spreading variants. The rapid rise of cases in a previously well-controlled situation in Newfoundland and Labrador is a testament to how quickly things can change when more contagious variants are introduced. Fortunately, the rapid, decisive public health response by the province is what is needed to stop a variant of concern in its tracks. Clearly, this has created frustration, but let's not allow that to detract from the progress we've made since the holidays. Because of our efforts, we are entering into a better situation than many countries. We have lowered infection rates across the country, protected our health system, prevented many severe illnesses, and saved lives. Though we may feel tired and have all suffered losses, collectively we cannot afford to take breaks. We need to protect our progress and keep the runway clear for the vaccine programs to expand, to begin to work. On several occasions, we have shown that working in a united front helps. We need to remain together. We need to work together with compassion and understanding and a shared commitment to see things through. This past weekend, a group of kids from Ottawa sent in the best Valentine's Day e-card ever. It was a beautiful heart-shaped collage with each child holding a heart in their hands, thanking us for our work. I'd like to pay it forwards and share their thanks for the dedication and commitment shown by everyone in Canada. And I know we have what it takes to continue. Let's vanquish the variants. Let's do it together. Thank you.
Thank you, Dr. New. So obviously now we're prepared to take questions. Corinne, à toi.
Merci, thank you. So we will take questions on the phone. One question, one follow-up each. Nous allons donc procéder aux questions au téléphone avec une question, une sous-question chacun. Opérateur, première question.
Merci. Please press 1 at this time for any question. Veuillez appuyer sur étoile 1 maintenant pour toute question. And the first question, la première question est de Catherine Lévesque de la Presse canadienne.
The first question is from La Presse canadienne, the Canadian press. Hello, my first question is for Ms. Anand. Why don't we have more specific figures with respect to the delivery of Moderna to the end of March? If you have any more specific figures, could you provide them to us?
Bien sûr, et merci.
Minister Anand, yes, thank you for the question. I would like to start by saying that we also will be receiving 1.3 additional doses of Moderna in March for a total of 2 million doses of Moderna by the end of next month. As you know, deliveries of Moderna come every 3 weeks. So we will have more details in the days to come. But for the next delivery, we will be receiving 168,000 doses. Following that, 1.3 million doses. Thank you. Follow-up question. So for the 1.3 million cases is coming. And my next question is for the doctors. Now, as you know, a lot of things are opening in Ottawa today. Restaurants, gatherings of 10 people inside, 25 outside. Based on your public health perspective, is this the right decision to make when, as you said in recent days, there may well be a third wave and these new variants?
C'est Dr. New, je pense.
Answer, Dr. New. I'd like to allow Minister Anand to start with replying to your first question, or should I continue?
Oh, OK, moi, je vais continuer. OK.
Dr. New still speaking. I'll continue then. And after that, I'll give the floor to Dr. Tam. Dr. Tam and I agree with our provincial and territorial counterparts that we need to continue to be very cautious with the new variants that are of concern. We can't give up. We need to maintain the measures that have proven themselves. It's always a delicate situation, establishing a balance. There's the economy, but for us in public health, we're very concerned. It's very important to carefully monitor the situation. We need to control and diagnose cases, do the testing and contact tracing, looking at the transmission chains. It all needs to be controlled. We have to monitor it closely. I know that Ontario and the public health authorities are following the situation very closely, and we'll see what happens in the weeks to come. An indication that the situation is changing. If there is an indication that the situation is changing, then the province of Ontario will react and respond. Perhaps Dr. Kam would like to add some comments.
OK, merci.
Et sûrement pour ajouter aussi, on parle aussi d'une.
Dr. New still speaking. Well, we're talking also about a potential third wave, where if we see an increase in cases, we need to look at the public health measures. We need to talk about a new trend in the infection rate. We need to look at if it's increasing or not. That's something we need to follow in the weeks to come. Thank you.
D'accord, merci.
The next question, la prochaine question est de Tonda McCharles from the Toronto Star. Please go ahead. Your line is open.
Yes, hi. I'm going to stay on the speakerphone if that's okay, if you can hear me. It's a technical problem I have today. Could I understand, well, a couple of things. Hang on one second. I'm going to try and pick it up. Give me one sec here because it's not working. Hi, I'll try to. Can you hear me okay? Hello?
Yes, we can.
Awesome, thanks. Sorry about that. Dr. Tam or Dr. New, yesterday you spoke about the new guidance for the second stage of the vaccination program nationally. I have a couple of questions on that. First of all, you suggest that it needs to be prioritized, or I guess the advisory committee said it needs to be prioritized, include or extended to include essential workers, but you don't define essential workers. You say that's up to the provinces. I'm wondering how then you see that actually coming into action. We've already seen sort of provinces making their own decisions around, in the first stage. What concerns do you have whether or not the concern around vulnerable populations, whether they actually will get the vaccines you suggest they need?
Hello, this is Teresa Tam. I'll take this question first. I think, people have seen that the NACI, the National Advisory Committee on Immunization, provides the guidance, and to date, I think there's been generally good adherence to some of these guidance by the provinces and territories, which is to really focus on those at the highest risk of severe outcomes, and some of those at the highest risk of exposure, such as those taking care of our frontline patients and personal support workers and others. So you've seen the long-term care facilities and senior homes being prioritized. So I think I had quite a lot of discussions with chief medical officers of health across the country. They provide, and I think everybody recognizes that Indigenous communities, individuals who haven't been covered to date, staff of and residents of congregate living settings, adults who are older, up to sort of 60 years of age, and those in racialized and marginalized communities, disproportionately affected, should be prioritized. I think that this is general from a public health perspective. And then, the NACI lists other essential workers and first responders, and that might depend on where what is in your community, etc. NACI does provide some recommendations on who which groups are sort of scoped into those areas. But obviously, in a local setting, you might have agricultural workers in one setting, but some other essential service in others. So that would be up to the province and territories. But I think that we'll continue to strive for as much collective coherence as possible, but everybody recognizes those at highest risk.
And can I ask about, today we heard from the NDP suggesting that the vaccine rollout, and perhaps this is for both Dr. New and Minister Anand, he suggested that the military ought to be involved in the vaccine rollout beyond just the logistics where you've brought in Danny Fortin, to set up sites and to be involved in administering vaccines along with whatever hubs the provincial governments have set up. I'm wondering if you feel that that would, A, be helpful or not, and B, would it help you actually prioritize some of the people that you want to see prioritized in that? In other words, is it a way to operationalize what you want to see happen in the vaccine rollout?
Ton, answer part of that question. If Dr. Tam wants to add something, she can. We have been, as a federal government, working with the provinces and territories very collaboratively and effectively, I would argue, in getting ready for the very significant increase of vaccines that'll be delivered to Canada over the next number of weeks and the next number of months. General Fortin and others, the Public Health Agency, certainly believe that the provinces have the capacity and the plans to ramp up effectively to deliver these vaccines to the populations in their jurisdiction that they decide to deliver the vaccines to. It properly is a provincial jurisdiction to determine the populations that they'll vaccinate in which sequence. Obviously, they have followed and benefit from the advice of the National Advisory Council and will continue to do so. But if the provinces determine in their own jurisdiction that they need increased assistance from the Government of Canada, if it's Red Cross, if it's military, if it's other surge capacities, obviously the Government of Canada will do whatever we can to support the provinces in those efforts. So the idea that there's some requirement now to have the military set up vaccination sites, the provinces will determine if they need additional assistance. And then, of course, they'll work with the provinces to find the most effective way to do that. The military, as you know, have been available and assisting in some northern and remote communities, in Indigenous communities, and we're working on plans ourselves to ensure that the Indigenous communities are able to effectively and safely receive the vaccines in a timely way. And I think it's only assumed the military can play a very effective supporting role in that effort as well. I don't know, Dr. Tam, if you wanted to add something.
Not specifically on the military, but I know that the human resource aspect is not the biggest concern, it appears, from province territories. We have many pharmacists, family doctors, other health professionals, retired. They're all volunteering and on top of the Red Cross, and so I think there are other kind of supports that they may need as well, which Major General Fortin may be able to provide more. He does his technical brief, but at the moment appear to be the critical factor.
Merci. Thank you. Next question. Prochaine question.
The next question, la prochaine question est de Mélanie Marquis de La Presse. Please go ahead.
Mélanie Marquis from La Presse. Question. My question is for Minister LeBlanc. With respect to the quarantine at hotel, the mandatory quarantine, when will that come into effect? Answer, Minister LeBlanc. You mean for travelers coming into the airports or people coming across the land border? Question, one or the other? Minister LeBlanc, we can get the details, the obligation to go into quarantine upon arrival at an airport, and with respect to testing at the borders, will be increased in the days to come, but we'll get you the exact information. The journalist, next question. My question is for Minister Anand. Now, I know you're not responsible for the approval of AstraZeneca, which is the next one in line, but do you expect it to happen this week, first of all? And secondly, with respect to supply, you talked about some pre-positioning, having some doses ready to roll them out. Do we have those doses in Canada, doses of AstraZeneca?
Merci beaucoup.
Minister Anand speaking. Thank you for the question. And I must say that I do not know when the AstraZeneca approval will come through. Because the process is independent of our work in procurement. With respect to delivery pre-approval, the answer is no. We are in discussions with the supplier on the subject and with respect to delivery following approval. But there's nothing further to say on that at this point. The discussions are happening right now. And when we have something to share with you, we will do so.
Merci beaucoup.
Thank you very much.
Merci, thank you. We will take a final question. Nous allons prendre une dernière question. Opérateur, c'est à vous.
Thank you. The next question, la prochaine question est de Mackenzie Gray from CTV. Please go ahead. Your line is open.
Hi, my first question is for Minister Anand. I'd just like to go back to the first answer you gave in French, Minister, on the Moderna shipments. You said that they're coming every 3 weeks. We're expecting 1.3 million doses per quarter. If my math is right and they're coming every 3 weeks, we're only expecting one more shipment after this, which would come on the week of March 15th. So is it fair to expect that on that week that we'll be getting 1.3 million doses from Moderna?
Thank you so much. There are a number of assumptions in your question, and I want to reiterate first and foremost that Moderna has indicated that it will provide the 1.3 million doses prior to the end of March. And on our calculations, after February 22nd, there are potentially 2 more shipments prior to the end of March. We are seeking a breakdown of the 1.3 million number from Moderna as we speak. And as I have done, and the Public Health Agency of Canada has done, we provide that information to the provinces and territories as soon as we receive it. And indeed, that is one of the ways in which we are upholding our commitment to transparency with regards to these delivery schedules. And this is unprecedented around the world. We are one of the only jurisdictions, if not the only jurisdiction, to provide real-time information. So as soon as we get that information, you will also receive it.
Questions for Dr. Tam about herd immunity. Dr. Tam, in the past, when we've talked about herd immunity, you've said that potentially between 60 and 70% of Canadians will need to be able to be vaccinated for herd immunity to be achieved in Canada. Dr. Fauci, one of your colleagues in the U.S., has started with that number, but now he's moved up all the way to 90% potentially needed because of the variants that have come in. Considering the new variants that we have right now, what percentage of Canadians need to be vaccinated in your estimation for Canada to get herd immunity?
Yeah, and just to reiterate the context around that initial response is that we're still continuously getting new information about the effectiveness of the vaccines. In particular, we are still awaiting information on the effectiveness of the vaccine in reducing asymptomatic infection and transmission. So, in many ways, everything that we try to sort of estimate is based on, for example, modeling information. And so that has to be understood that we still waiting for that data. But in general, the more you vaccinate and the highest level of vaccination will achieve better protection for all. So that's the concept. So I think any of the estimates must be taken with a degree of, reality check that we're still waiting for some of that scientific information. Having said that, what Dr. Fulci is saying is that with the variants, if they're more transmissible, you actually are much more likely to need a higher level of vaccine coverage than if you didn't have such transmissible variants. So that is the sort of principle underlying what he's saying. So really is, the message to Canadians is roll up your sleeve when your turn comes and just keep going.
Thank you. Merci. This puts an end to today's press conference. Ceci met fin à la conférence de presse d'aujourd'hui.